To the Thursday, August 25th, Washington State Department of Health media briefing. I'm Nikki Ostergaard, your facilitator for this event. I'd like to welcome our panel for today. From the Washington State Department of Health, we have Dr. Umair A. Shah, Secretary of Health, Dr. Scott Lindquist, State Epidemiologist for Communicable Diseases, Lacey Fehrenbach, Chief of Prevention, Safety, and Health, and Nathan Weed, Acting Chief of Resiliency. And we'd like to welcome our guest panelists for today, Manny Santiago, the Executive Director with the Washington State LGBTQ Commission. Over to you, Dr. Shah. Thank you.
Thank you, Nikki, and thank you all for joining us this morning. And I want to start by thanking my fellow panelists. In particular, I want to thank Manny Santiago for being here today. We've worked very closely over the last many weeks, and I really want to appreciate your leadership and continued connectedness with community. So thank you, Manny, for joining us this morning. I come to you from Clark County. Actually, Clark County Public Health right now, and I just want to start by thanking Dr. Alan Melnick, the director here at Clark County Public Health, for he and his team's warm welcome, as well as the continued partnership as he has, just as so many local public health leaders across the system have led during very difficult times during this COVID response. I also want to thank our media partners today. Very much appreciate all you do to get our important information out, and also, again, hoping that all of you are also staying safe in the summer and staying cool on what looks like still some continuation of hot days. And that's not just for our media partners, but that's for all Washingtonians. I'm going to start with just a couple of updates, and then our team will go into some additional specificity around various things. As you know, yesterday, King County, Seattle King County, announced the first confirmed pediatric case for MPV, which brings us their first confirmed pediatric case for MPV, which brings us to 2 confirmed cases in those under the age of 17 in the state of Washington. As we know that this continues to be an outbreak that we are monitoring very closely. We have now 392 cases in Washington state, as you can see here, with the information that's being put up by our team, with 318 of those in King County. We have 12 reported hospitalizations as of August 24th, and we also are in the context of now close to 16,000 cases in the U.S. and just shy of or at 45,000+ cases globally. There have unfortunately been deaths across the globe, but we are fortunate not to have any deaths here in the state of Washington, though, as I mentioned, we have had 12 reported hospitalizations. We must continue to remember this is a contact-based virus. It is not limited to any community. While it is disproportionately affecting right now the LGBTQ+ community, anyone, anywhere can be at risk if the behaviors, including that skin-to-skin close contact with an infected person, are what is occurring. Again, it can be spread in a household to anyone in that household, and this is a contact-based virus. So we want to make sure that we are doing everything we can to remind ourselves not just of the importance of vaccines, but also the importance of prevention. As a reminder, the risk to the population, the general population of the state of Washington remains low, and we want to keep it that way. But our message to the general population, to all of us, is that if you have a rash that you have not sure what it is, get it checked out. Keep it covered. Be careful of your contacts with others. Avoid direct skin contact and sharing items with anyone in your household until you get it checked out. So even to the general public, our message is if you have a rash, get it checked out, keep it covered, and also make sure you are not exposing that rash to others. Again, we've been monitoring MPV prior to its arrival in Washington State. As you know, the first case in the U.S. was in May 17th. We had our first case May 27th. And since that time, we have activated a number of different activities related to our incident command structure, ICS structure, which was activated in late July at the Department of Health. On August 11th, we launched our MPV hotline, and I want to remind everybody of the importance of this hotline to answer questions that the community may have about MPV, and that can be reached through 833-829-HELP. That's 833-829-HELP, H-E-L-P, and we would ask our media partners to amplify the message and the voice to be able to get that information out. In addition, if somebody dials through 211, they can still be transferred over to the MPV hotline as well. On August 12th, Governor Inslee, as you know, issued Directive 2218 to control the spread of MPV, and that was directed to the Department of Health. We have been working with the governor, his team, prior to that directive, as well as continue to work with the governor, and he is obviously very concerned about continuing to do everything we can to protect citizens and residents throughout the state of Washington. As you will note in that directive released on August 12th, there were 9 directions to the Department of Health, including everything from public outreach to data and case count information, as well as supporting our local health jurisdictions. I can't say enough about our local health departments. For example, again, here in Clark County, as well as throughout the system, all of our local health departments in the midst of responding to COVID-19, a whole host of other issues, continuing to remind themselves and remain committed to responding to MPV is just a testament to what they have been needing to do and also stepping up to do. From a vaccine standpoint, we have received 16,210 vials of vaccine, which is 100% of our current allocation through phase 3. You'll get more information from Lacey and team about that. This includes 2,400 vials delivered after the FDA EUA expanding the number of doses per vial. As you know, the FDA has said that we can get up to 5 doses per vial. But I think it's important to say that some have confused that message to think that it is 5 doses per vial. It is up to 5 doses per vial. And in fact, we're seeing real world play out that it's closer to 3 or 4 doses for many providers per vial. So that also is important for us to keep in mind. If I can shift very quickly to COVID, just a reminder, let's not forget the virus is still with us. We know Labor Day is coming up, and we have a whole host of travel, kids going back to school, people gathering and doing all sorts of things. We want to make sure people are staying safe in crowded settings. As you know, with our Washington, both cases and hospitalizations, we are monitoring this, as we said in our Walk Forward plan in March. The good news is with hospitalizations, we're seeing a slight downtick, with 11% of our hospital beds in the state are now occupied from COVID-19 related patients. I do want to make sure it's clear that does not mean that our hospital system is any less strained. We know that delay of care and staffing challenges, as well as the difficulty to be able to place patients when they're finished with their acute care continues to be a challenge. And that alleviation of stress is something that we continue to stand by and also continue to support our healthcare system. We want to remind individuals to help us. Please get vaccinated, get your booster. There is going to be some updated information about boosters from our team as well a bit later. Reminder of masking, mask up in crowded spaces, especially indoors, and certainly social distancing. And again, with the weather being nice, taking it outside and ventilation as best we can. These are the kinds of things that are going to be very critical to our continued success with COVID-19. Testing and isolating when you have symptoms. Don't forget, you can continue to order a free at-home test through our Say Yes to COVID test portal. And I know that information is up. I want to make sure everybody is doing everything they can to have a set of tests available in case they have symptoms or they've been exposed to somebody with COVID-19. We know we're in the midst of wildfire season, and although it's been a mild season so far, we want to, again, knock on wood and keep it that way. It's important to be ready to protect ourselves from smoke and heat, and we know the best way to protect yourself and your family when it's smoky outside is to stay indoors and keep indoor air as clean as possible. Close windows, doors, taking steps to filter indoor air, and also checking smoke and fire conditions, including forecasts on the Washington Smoke blog. That is really critical. I want to thank our local partners who have been fighting wildfires and heat-related issues, smoke-related issues, whether it's in the healthcare system, emergency management, our fire and law enforcement colleagues, or in public health. Everyone has just done a continuation of a great job, and we want to thank everyone for their hard work. Final point that I wanted to make was around our transformational plan. Just a reminder, our transformational plan is a vision for health in Washington state. This is really about what we can do together, learning from the COVID-19 pandemic as well as MPV, and apply it to the road ahead for better health for all Washingtonians. We do believe this is our opportunity to move from transactional health to transformational health, and that is what this plan is all about. I hope you will have a chance to look at the plan. It has 5 key priorities around health and wellness, health systems, workforce transformation, environmental health, emergency response and resilience, global, and One Health, rounding it out. And this plan also builds on the pillars of our prior agency strategic plan and its vision for equity and optimal health for all, as well as recognizing the importance of our cornerstone values of EIE, equity, innovation, and engagement. So let me just stop by saying the threat of MPV to the broad general public remains low, but we do recognize it's a contact-based virus, and so it is not limited to any community. We have to take all the preventive precautions that we can, and we also don't want anyone contracting this virus, but we're doing everything we can to certainly prevent that from happening, and also treating all those with exposure. The best thing you can do is protect yourself. Please take caution, take care of yourself, whether it's related to MPV or COVID-19, and we also want to make sure you remember that it's hot outside, and also we have wildfires at times that may require you to follow the directions of your local emergency responders. So with that, I just want to say thank you again to our media partners. I'll turn it over to Dr. Scott Lindquist.
Okay, thank you. I just want to do a couple things here. One is to reiterate some key points that Dr. Shaw has already made about monkeypox, and that is, I know we're all used to being in a pandemic. We're used to COVID, which is a very large outbreak, but this outbreak of monkeypox in the midst of COVID is a large outbreak by itself. 392 people with a new disease is very disturbing. And I just want to make sure everyone's aware that this is a maturing outbreak. So when this may have started within certain populations, it is now starting to move to people outside of men who have sex with men, such as women and kids under 18. So this is a maturing outbreak. And because of that, one thing we want to make sure is that providers are being open-minded about a rash that comes through their front door. And so this is called, in healthcare, it's called the index of suspicion. And we are asking our providers to have a much broader index of suspicion for rashes that come through the front door. Now, it's very clear if you're a person who is around a case of monkeypox, you're at higher risk. But anyone can be around a case of monkeypox and be at higher risk. And so we really are asking our providers to look and test. And the good news on the testing forefront is, unlike COVID, we actually have a lot of access to testing. Not only does our state public health lab do testing, but many of our commercial labs in Washington state have moved to being able to test for monkeypox. And so this is all good news. And then last thing, I want to make some space for Manny Santiago to talk about specific concerns and the extra caution we need to take and care that we need to take for portions of our population. But I really do want to give a shout out to all those that have had monkeypox. It's 392 people. This can be a very, very painful disease. It can be embarrassing. It can be stigmatizing. And I think we, as the public, need to do a good job of having some compassion for all of those that have had monkeypox and be open-minded about anyone is at risk for this. And so with that, I want to make some space for Manny to talk about concerns. So I turn it back to you.
Thank you, Scott. And thank you everyone for being here. Thank you, Dr. Shah and the Department of Health for inviting me to share with you all today. As we know, MPV is a virus that affects all Washingtonians, regardless of sexual orientation or gender identity. Viruses do not have a predetermined plan to impact one community over another. Both behaviors and the social context in which communicable disease is spread have much to do with the impact that it's going to have on different communities. And it is undeniable that the MPV virus has disproportionately impacted the LGBTQ community, in particular gay men and transgender people. This does not make this virus a gay disease. And although a lot of reliable information is being distributed for the public to know what MPV is, how it is spread, and how we can prevent it, there is also plenty of misinformation out there. Misinformation and the disproportionate impact on the LGBTQ community has led to stigmatization of our people. Some of the best tools against stigmatization, discrimination, and misinformation are education, engagement, and open conversations. The Department of Health and the LGBTQ Commission have worked together to reach out to the LGBTQ community in Washington with accurate information on MPV. In the past couple of months, the Department of Health has held conversations to address the concerns of the community and to answer our questions. The Commission continues to receive regular updates on the status of MPV virus in our state and how it is impacting vulnerable communities such as the LGBTQ community. And just yesterday, Secretary of Health, Dr. Shah, sat down with a group of LGBTQ commissioners and community representatives for a recording of an informational video that will be distributed through our commission in the coming weeks. Some of the ways to prevent the spread of MPV is by answering your phone when the DOH communicable disease investigators call. Please answer their questions. This will help you to access vaccines, and it will help your community by ensuring that the right treatment is delivered at the right time, thus lowering the community contagion. Another way is by accessing the resources that your local health departments offer, provided by the State Department of Health. And for the LGBTQ community organizations, please reach out to your local health departments to access the resources for our community. For individuals with symptoms, please seek out medical care as soon as possible so you can get access to treatment and to help keeping our community safe. I am grateful for the work that Dr. Shah and his team at the Department of Health have done to be intentional in engaging the LGBTQ community in these conversations. We have offered input on how to best reach out to the most vulnerable among us. We have offered feedback on how to best talk about this human disease. And the LGBTQ community is holding our public institutions accountable for the work that we are entrusted with doing, which is to serve our constituents. I'm also grateful for the way in which the Governor Inslee, has prioritized the response to this health crisis by taking swift action and listening to health experts on what the best course of action is to stop the virus in Washington. Now, there's one invitation that I want to make to the media, health professionals, and institutions that are committed to stopping MPV from continue impacting all of our communities. My invitation is to be thoughtful, intentional, and cautious in the way that you talk about this disease. Your words have power, and the way and they have the power to stop the stigmatization of a community that has already lived through a similar experience when the HIV virus was first discovered in the 80s. Our communities rely on you to deliver accurate information that helps prevent the spreading of the disease while also stopping the stigmatization of our community already vulnerable. I know that the LGBTQ community can count with your support. So thank you very much.
Annie, I just want to say thank you for those strong words and everything that you have done to continue to work with us and also to advocate for community members across Washington. Thank you, thank you, thank you. And I hope our media partners will absolutely heed that message. So thank you so much for being here.
Thank you, Dr. Shah.
Thank you, Executive Director Santiago. Next, we'll go to Chief of Prevention, Safety, and Health, Lacey Fehrenbach. Lacey, go ahead.
Good morning, everyone. Glad to be with you here today. Thanks for taking time. I am going to shift gears a little bit and talk about COVID and getting ready for school. We have some cautious optimism around our COVID-19 trends statewide. We are seeing a decline in cases, hospitalizations, and death compared to last month, though disease levels are still relatively high. So keep taking the measures you're taking to keep your family and community safe. Vaccines and boosters are a key focus, and we want to do everything we can to keep our community safe in light of the ongoing pandemic, and also to ease the burden on our healthcare system, in particular hospitals, as you heard Dr. Shaw allude to at the front of the briefing. DOH did release updated COVID-19 guidance for K-12 schools and childcares at the beginning of this month on August 5th, and in preparation for the upcoming school year. And that guidance is available in multiple languages, and there is a summary brief available for school and childcare workers. There is one for families and caregivers, and these are on our website and available in English and 39 home languages to support accessibility. Our requirements and guidance for the upcoming school year are pretty similar to how we ended the prior school year. So for the people that work in schools and childcares and students and families, it should feel very familiar. There's a limited set of requirements that schools must do, and those are complemented with recommendations that emphasize the layered prevention measures that limit transmission in the school environment. This is in recognition of a movement to a more shared responsibility between schools and childcares and the families that are in that community, as well as the widespread availability of tools that we can all use to protect our own health, the health of our families, and the broader community. Things like vaccines, rapid antigen tests that can be done at home, quality, affordable, well-fitting masks that we can wear when disease is high or if we have a risk in our family, and antiviral medications for those who get COVID and are at risk for severe disease. We continue to encourage schools to work with their local health department and consider their local context when selecting additional measures to help reduce COVID transmission in their community and in their buildings. And particularly that they do this in strong partnership whenever there's a high level of disease or potentially an outbreak in the school. Schools and local health officials have always the ability to implement more protective measures depending on their local context, and that can be in general or in response to an outbreak in order to help keep students, children, and staff in person and as safe as possible. I want to note that we are looking, and this is broader than just schools, at the updated CDC guidance around isolation and quarantine, and in conversations with our partners at the Department of Labor and Industries, and reviewing our own recommendations to determine how we make these alignments over the next week or so. So stay tuned for more to come on that. And we also want to remind Washingtonians, in addition to having those tests on hand through the Say Yes to COVID home test program, or if you've purchased them, to please utilize them, have them available for Labor Day and back to school, and take action to keep yourself and your family safe ahead before travel, as you transition into new environments, or if you're going to visit a high-risk individual. COVID vaccines and boosters remain the best defense in protecting from serious illness, hospitalization, and death. And if you are eligible to receive your first or second booster, we encourage you to do so. We are planning for the release and availability of a bivalent booster in the fall that includes protection against Omicron variants, and we expect that to be available shortly after Labor Day. However, we're still awaiting FDA authorization and the recommendations from CDC's Advisory Committee on Immunization Practices for that bivalent vaccine. And we expect that when it first becomes available to us, supply will be very limited. So for those of you who are not at risk for severe COVID disease, please plan to be patient in the first few weeks, couple of months, so that those at greatest risk can get that vaccine first. Washington State has ordered a total of 191,900 boosters that will be released in 2 waves. The first wave is 82,100, and then the second is 109,800. And we expect those boosters to ship the week of September 5th after the Labor Day holiday to be pre-positioned around the state and available as soon as they're authorized and the recommendations come out. Currently, the eligible populations for receiving boosters for COVID-19 remain the same. I also want to note that starting this week on Monday, Caravan and the Power of Providers, or POP initiative, are hosting a series of 9 COVID-19 booster clinics across the state at 6 college campuses. And those are running this week through the end of October. Each campus will hold at least 1 clinic that's open to the general public in addition to their students. And you can also find available appointments for vaccines in your community on vaccinelocator.doh.wa.gov. I also want to take this opportunity to remind families, in addition to COVID-19 vaccines, it is a great opportunity to make sure your children are up to date on all of their required vaccines and recommended vaccines as they prepare for the upcoming school year. Let's go back to school up to date to keep our kids safe from all of the vaccine preventable illnesses. COVID-19 did impact childhood immunization rates, and that is due to a number of factors: closures, disruption in healthcare delivery, people choosing not to go out, and younger children have been more impacted by this. So please check your requirements, make an appointment with your primary care provider. I want to remind folks that the childhood vaccine program provides vaccines at no cost to all children in the state, 19 years of age and younger. And you can find a clinic at immunitycommunitywa.org. If you have questions about any of the required vaccines for childcare entry or school entry or COVID-19 vaccines, please write those questions down, talk to your healthcare provider or your school nurse. We really encourage you to make your childhood vaccine appointment as soon as possible, especially if your children are behind at all on any of your recommended vaccines. Wrapping up, we're super excited about the return to fall and want to wish our families, the students and staff a wonderful school year. We are grateful to have a broad set of tools available to support families in navigating school during the pandemic. That includes Say Yes to COVID test, no-cost vaccines and boosters, masks, and it is imperative that we all do everything we can to keep our kids healthy and safe and in school as they start the year and we move into the fall respiratory virus season. So back to you. Thanks.
Thank you, Chief Fehrenbach. This brings us to the Q&A segment of today's briefing. We have 3 reporters in the queue. We will begin with Nicole Jennings with Cairo. Nicole, go ahead.
Nicole's here.
Hi, can you hear me? Nicole is unable to make the meeting today. This is Diane at Cairo Radio. You hearing me?
We can hear you fine, thank you.
Excellent. I wanted to ask, it seems like there are some people saying that we now pretty much have pretty strong herd immunity between, the estimations that 80% of the population has now had COVID, boosters, new vax coming. People are really still not starting to chafe at the emergency order. So I'm wondering if the health department still believes an emergency order is logical, and if so, why?
Thanks, Diane. I'll take that. And Lacey, and we should have mentioned that Nate Weed is also on representing our health securities area. So I think it's really important that if they have anything they want to add. It's a great question. From our standpoint, what we want to remind everybody is that the emergency order, emergency declarations, as you know, many of those proclamations have been rolled back, but the key issue for us is continuation of the flow of procurement, contracting, and a whole host of behind the scenes administrative activities that the emergency proclamations or the orders allow us to continue to do. We know we are not past COVID-19. We know that it is, especially as we committed to in our WA Forward plan that was released in March, there are a whole host of continuation of activities that we need to be doing as a state in order to protect our community members, and we're committed to doing that. So I do think from a Department of Health standpoint, the continuation of the procurement and many of those administrative behind the scenes opportunities and activities are absolutely critical to our continued response. And I think that's been one of the challenges we've been seeing with MPV is that, there has been a limitation, especially on the federal government side, with the use of COVID-19 funds and or resources for our MPV response. And this is not a Washington state phenomenon. This is an across the country phenomenon. And that has been something that we have articulated back to our federal partners, the importance of being able to have flexibility with our COVID-19 resources so we can continue to mount the appropriate response to MPV. So again, these are all interconnected pieces, but that's why it's so critical that we continue to leverage all of the available resources that we have in order to be able to respond for our community members.
Thank you, Dr. Shaw. Our next question comes from Kate Walters with KUOW. Kate, go ahead. Just one moment.
Hi, thank you so much for taking the time today. I appreciate it. If you will allow me, I would like to ask one COVID question and one MPV question. To start with the COVID question, do you have a sense of where schools across the state stand in terms of ventilation? I know that indoor ventilation is obviously a big part of helping to reduce spread, and would just love to know whether the Department of Health has any kind of sense of whether there are school districts that are lagging behind in that sense, or whether there's been a pretty good effort across the board to improve ventilation. And then for MPV, Manny, I would love if you could tell me what is the biggest message that you would like the media to take to the broader community when it comes to where we are at right now with this outbreak?
Thank you, Kate. Manny, would it be okay if I turn to you first for the message? I think you have already articulated, but I think it's so critical to start with that, and then I'll turn it to Lacey for the second part of that question. Thank you, Kate.
Absolutely. Thank you, Dr. Shah. So thank you, Kate, for the question. I think that some of the most important things are for the media and health care providers to ensure that the message goes out that everybody needs to take precaution. Everybody is at risk, that it is behavior that we need to, to monitor ourselves to ensure that we stay safe, that we have to pay attention to the symptoms, and that all that is for everybody. So there's not one community that is responsible for taking care of the whole community. Each and every one of us has to be responsible for ensuring that all Washingtonians are safe and healthy, and not to single out our community when talking about the spread or how things develop with the virus, but actually talking about the actions, the behaviors that are that help with the spread, or if we change some behaviors, then we can stop the spread. So do not single out communities. We have a way of reaching out to specific communities that need extra information, that need extra support because of their vulnerability. But when talking about these on the media, on TV and radio and all that, ensure that the message goes out to everybody. And that way, everybody's taking precautions, everybody's following directions, and everybody's caring for themselves and their communities.
All right, and I will shift over to talk about ventilation. I do want to note, and Manny did say this early on, but making sure that if public health reaches out to you, and this is true like COVID or monkeypox or any other virus, please answer the phone. We're there to help assess, and also a reminder that all of that case investigation, contact tracing, communication is confidential. So please pick up the phone. To the question on ventilation, we don't have like a statewide assessment building by building. What I will say is it's very, it's variable, and schools are a varying size and capacity. So we have written guidance that sort of meets schools where they are, and this guidance can be used for non-school buildings, by the way, any sort of building, and looks at the general considerations that you can do to maximize your ventilation if you have an HVAC system, if you don't have an HVAC system, and even how to use things like portable air filtration. So there are lots of ways that schools, no matter where they are on the continuum, can improve their ventilation to prevent transmission of COVID and also other respiratory viruses, by the way. And we strongly encourage them to do that. That is in our guidance. And And DOH also is available to help provide assistance to schools with this in terms of technical assistance. Most buildings have their own engineer that they need to work with that sort of knows how they're set up and structured. But we're happy to help if we can, and we have a great team that does that. And they have also been meeting regularly with the school network to provide guidance around ventilation, as well as all of the other layered mitigation measures that schools can use.
Thank you, Chief Fehrenbach. Our last question comes from William Stone. William, go ahead.
Yeah, I'm just curious how you're thinking about, the cases and whether are there any signs that maybe things are slowing down or in terms of new monkeypox cases. I mean, that they're starting to see that a bit in New York City and San Francisco. And I'm just curious how you see this outbreak playing out. And do we have enough data to make any statement like that?
Yeah, thanks, William. And I'm going to turn that to Dr. Lindquist. The one overarching message that I would continue to have that we've said during COVID-19, and we say during any time we have a movement of a virus or an outbreak, is that it's both emerging and evolving. And when you have the two E's of emerging and evolving, yes, there are positive signs here or there. There's information that's important for us, but we cannot let off our guard. And that is so critical. And that, I mean, COVID-19 has been the most recent example of why there are twists and turns. And we have to continue to stay vigilant about all the twists and turns that MPV can take as well. So there is a real critical piece of signs and data and information, but also recognizing that until we are comfortable that we have moved past a very critical phase in our response for MPV, we want to continue to make sure that all of our efforts stay focused on response. So with that, let me turn it to Dr. Lindquist.
Yeah, and I'll just answer you very directly on this. There's not enough data to say that we're on the downside of this epidemic. We look at things such as cases over time, and we call it an epi curve or an epidemic curve. We are yet to see a stalling out that's consistent, meaning that the cases are not increasing as fast, and we are not seeing a downturn yet. When we look at our data, it still has a couple days that looks promising, but until that data is complete, we can't really make any statements about it. And I am yet to see that sustained decrease in cases that I could answer your question directly to say, yeah, we're seeing a downturn. We are not there yet. It's a great question. New York has done the same activities and prevention that we are in Washington State. Yes, they had a lot more cases. We have fewer cases, but we, in all intents and purposes, should see a downturn in our cases and a change in our epi curve within the next month for sure.
This brings us to the end of our Q&A segment for our briefing. Dr. Shah, would you like to offer closing remarks?
Yeah, thank you, Nikki. And again, thank you to all of our panelists. I would, before I offer my closing, if I could ask Nate Weed and Manny Santiago if they have anything in particular they want to say before I offer my remarks. I think it's important to, again, reemphasize the messages that Manny had already provided, and also Nate, if there's anything else you wanted to add to the mix.
Thank you, Nathan, and thank you, Dr. Shah. Just a reaffirmation of the message. Remember that this is a human disease. We need to portray it as such. We need to ensure that all of our communities are safe and be clear about the message, be honest about the message, and when reporting, ensure that all of Washington has accurate information, not just segments, but that everybody is taking the information. And if you are experiencing symptoms, reach out to your local health department. And for community organizations, reach out to your local health departments. You're more than welcome to reach out to the commission. We can put you in touch with them and ensure that the resources are there for the community to be safe and healthy.
Yeah, thank you for that. And thank you all for having me today. I would say we covered a little bit of ground here today and would just emphasize that as we look at the MPV outbreak, the COVID pandemic, heat waves, smoke from wildfires, there are always threats to our public's health in Washington, and our health departments, both the state health department here, as well as our local partners and our tribal partners, work diligently every day to ensure that people are safe and that those community members that need additional support as we face these health threats have the support they need. And at any point, I welcome any other follow-up comments or questions, and I'll turn it back over to you, Dr. Shaw.
Thank you, Nate, for those remarks, and thank you, Manny, for your continued partnership. And I know we are going to continue to work together, and it is so critical that we do so, because we have to emphasize, as you mentioned, that this is a human disease, and we have to do everything we can to continue to respond in kind. I want to thank Manny. I want to thank Lacey. I want to thank Dr. Lindquist. I want to thank Nate. I want to thank Nikki and all of our team for continuation of these convenings so that we can share good, accurate, timely information with the public. I also want to thank our media partners. Just the final message here is that, summer has been long. It has been a twisty-turny type of challenging summer. And, if you think back where we were a few months ago when it comes to whether it was COVID-19 or not even appreciating initially, what heat or wildfires or smoke was going to be in the midst, and then certainly recognizing all sorts of challenges with MPV. This has been a long summer indeed, and yet it is not over. We want to wish everybody a good rest of the summer. We also recognize that Labor Day is right around the corner. Please stay safe in a number of different ways. Please stay safe for the rest of the summer, and absolutely make sure you do everything you can to remember prevention, prevention, prevention. That is the key to how we continue to take on a whole host of challenges that all of us face every single day. I hope you will have an opportunity to continue to get the word out about our transformational plan, a vision for health in Washington State. We do believe that this is an opportunity for us not to just be transactional, but transformational when we approach any health issue throughout our state that any Washingtonian is facing. And we look forward to working with you in that regard. The final message for me is to thank you again to Dr. Alan Melnick and Clark County Health for allowing us to share their space today and spend a little bit of time. We look forward to continuing to be in Southwest Washington here, as well as throughout the state, again, as we take on a whole host of other issues across our great, fantastic state that we have in the state of Washington. And with that, thank you again, and I will turn it back to you, Nikki, to close.
Thank you, Dr. Shaw. This concludes today's media availability. I would also like to thank our panelists for their time today and our media partners for making time to join us for this briefing. And also thanking TBW for hosting today's live stream and archives of past briefings. Thank you, everyone, and take care.